Welcome into another edition of COVID Conversations. I'm Adam Gaub. I'm here with Lisa Marisiddaiah. She is the Gastonia parish nurse, and she's going to be talking to us a little bit today about kind of what she's done during the COVID pandemic over the last, almost 20 months. So Lisa, thanks so much for joining us today.
Absolutely. Thank you for having me.
If you can, just kind of tell us a little bit about what the parish nurse ministry is all about, kind of how you got involved in that.
Sure. I've been a faith community nurse since 2008, a relatively new specialty of nursing, recognized by the American Nursing Association, and started out with that in 2008. I head up the Gastonia Parish Nurse Ministry, which serves primarily the members of First United Methodist and First Presbyterian Churches, Gastonia. They support my efforts, and I do community outreach through health education, awareness, and screenings into the community.
So what was a typical day or week like for you before we got into the pandemic?
Every day is different. I usually have a plan, but with a phone call, it can totally change my direction with somebody's health needs, directing them to resources, helping them through a crisis. With the church members, I help every age group, so it could be prenatal to end of life. So every day is entirely different.
So you have to have kind of a wide range of knowledge in terms of kind of a variety of different healthcare issues if you're helping kind of young mothers, folks like on the opposite end of the spectrum. Is that something that you did a little bit of on-the-job training for? Was that something that like you felt equipped for when you kind of stepped into the position?
There's actually special certification and training for faith community nursing. So I did my training shortly after I was hired. I did that through Duke Divinity School in their health and wellness division. And I like to think that I'm really knowledgeable about the resources in the community. So that's a big piece of my job, is connecting people. So faith community nursing is a combination of nursing, social work, and counseling and ministering. So kind of the combination of all of those, and certainly not delving into anything that I'm not comfortable with, but I know where to refer people to. So.
And you got involved with the county fairly early on when we got into the pandemic in terms of kind of partnering with the advisory task force that we have, and talk to me a little bit about kind of the initial months of COVID and kind of where you saw your role, and then kind of maybe where we are today.
Sure. Well, I've always had a great working relationship and partnering with the health department, even prior to the pandemic. So I know a lot of the staff, I know a lot of what they do. When I was asked to join the COVID advisory task force, a lot of my efforts were helping people in the community and, starting out with my congregations that I'm responsible for, having easy access to COVID testing. So we started every other week, we were working with Contegra to host their mobile vehicle to offer testing in our parking lots. Once the vaccine became available, I jumped right into hosting vaccinations on site. And so a lot of that was for the church members, our outreach into the community. And then I asked if I could partner with someone who was bilingual, and we started to really target the Latinx population. And so we did some really strong clinics on site at the churches, at times that are a little unconventional. We did them in the evening, we did them on Saturday afternoons, Sunday afternoons, just to make it convenient for people who couldn't get to the vaccination clinics that were Monday through Friday.
Sure. Yeah, I mean, obviously, the clinics that the health department offers, like you said, are kind of those normal kind of working hours. And so for people that literally just can't get that time off of work, I mean, it's nice to have that as a resource. We were talking a little bit before we sat down, and you were saying that you've been busy over the last few weeks in terms of setting up some different vaccination clinics. What does that look like?
Yes, so I've been working a little more closely with the Gaston County Public Health Department as a faith health liaison. So I'm working diligently to connect with faith communities and helping them to set up clinics at their own site. So to offer it conveniently in conjunction with regular seasonal flu clinics. So we're doing flu, COVID vaccination clinics, and boosters all in a combined effort and been really successful with how that's being received. And I'm working with some private pharmacies to support that. And if there's any congregation of anyone watching this that is interested, they can let us know. We can have that set up as well.
Do you feel like it provides maybe an additional level of comfort to be able to do the clinics kind of in coordination with these different faith communities?
Absolutely, absolutely. And I think people appreciate having it on site and, as you mentioned, a place that they trust, a place they're comfortable with. I usually try to do them in conjunction with another event that's happening on site at the congregation, so people already coming for a reason.
Sure.
So it's convenient. I get nothing but thank yous as people are leaving. So it's been good all the way around.
You know, the last couple of weeks, you know, we're finally starting to see the numbers go in the right direction again after kind of coming through the spike with the Delta variant. You know, what do you see your role as in the months ahead as hopefully those numbers continue to decline?
I think we will continue to offer the clinics as much as we can. There's still a lot of people that need to be vaccinated first time around, so we're hoping that people can, you know, get the education that they need, have their questions answered, maybe feel more comfortable. I was told yesterday that some folks who are coming now for their first dose feel that enough research has been done that they're at the point of offering boosters, and so they are currently ready to get that first start at their vaccination series. So that's encouraging.
Yeah.
And then I think we are getting ready to start a new cycle with children. So as that's being approved, we'll get those set up as well.
You know, you talked a little bit at the beginning about kind of, you know, strengthening these faith and health partnerships by kind of doing this outreach to different congregational leaders. You know, what has that been like, and what has the reception been as you've tried to work with different faith leaders kind of across Gaston County?
It's been great. It's been well received. I already have a good relationship with many of the faith community leaders in Gaston County. We have set up a lot over the course of the last month of new clinics coming about, and I see that being, you know, the momentum is building.
This is something that kind of came up in a conversation that I had with some health department folks earlier this year, but you know, if there is, and hopefully there's more than one, but if there's been one positive that I've seen from the pandemic, it's that people have had a much closer connection with maybe the county's public health department and maybe valuing kind of what they bring in other avenues and other outreach efforts that they'll continue to try to do. That maybe was work that was already ongoing, but people just didn't notice it before. I mean, are you kind of maybe seeing some of the same thing that maybe now you'll be even better connected with some of these communities and some of the residents here?
Absolutely. I think I can be a liaison between the faith communities and some of the programs that the health department offers, working to establish further relationships beyond the COVID clinics that we're setting up right now to have representatives from the congregations who have an interest in health and wellness step up to be a contact with me. And in that we can, partner to set up other programs beyond the COVID clinics. There's a lot with Faithful Families, healthy eating programs, different activities, just parenting programs. The health department offers a great variety of things, and I'm hoping that my relationship with these congregations will strengthen that and get more people not only aware of what's offered, but actually accessing those at the convenient spot of their congregation.
So in addition to doing some of the vaccine clinics, you've also been offering COVID testing in kind of the downtown area. I mean, not far from where we're sitting right now, correct?
Correct. That is also a partnership through the health department with a company called Optum. We have COVID testing every Monday, Tuesday, and Friday at First United Methodist Church. No appointment needed. It's from 9 to 12 and 1 to 5 p.m. on those days. If someone finds out through their reporting that they have a positive test, they can go to StarMed for the antibody treatments, and that's located over on MLK Boulevard, and so just a good system in place for that.
Anything else that you wanted to mention about just kind of the work that you've been doing, or the time that you spent on the task force that I didn't ask about that you feel like would be important for folks to know about?
I think it's just encouraging to see people responding through the faith communities, through the community itself. I think there's a lot of opportunity for continued growth and relationship building and just partnering to be there for each other. I think the pandemic has shown us that people have needs and we need to be good neighbors. And if anything, in my role, if I can help to encourage people and provide them the resources to do that, that's a good day for me.
Well, the note that you had mentioned about people coming and being willing to get their shots for the first time because now the boosters are available, like that wasn't something that I had thought about, but it's encouraging to hear that people are looking at that, and now that more people have had the vaccine, and like you said, now the boosters are available, maybe it's providing that sense of, okay, these people are taking these, millions of people across the U.S., over 1 billion worldwide have taken the vaccine now. It's proving to be safe and effective.
Right.
Lisa Marisiddaiah, thank you so much for joining us today. We appreciate all the work you're doing in the community.
Thank you. My pleasure.
We're going to turn next to a look at the key metrics here for this week in Gaston County. Thanks so much for watching.
Last week, there were 285 cases, which averages to 42 cases per day. That total number is down from 352 cases the previous week. Of the 285 cases reported last week, 78 of them were pediatric cases. We had 41 hospitalizations last week. That number is down from 63 hospitalizations the week before. Unfortunately, we had 6 deaths last week. However, that number is down from 14 deaths the week before. That concludes this episode of COVID Conversations. Thank you so much for tuning in. For more information about COVID-19, please visit GastonSaves.com.